Cancer staging. Why stage language changes and how this affects usage. There is often a conflict between the need for change and the need for stability. The needs of clinicians and the surveillance community are different. Clinicians and patients want changes because there is new and convincing evidence for better understanding disease behavior, improved prognosis following better management, and emergence of new diseases. For example, oropharyngeal cancer was traditionally due to smoking-related diseases and staged using a suitable classification within the TNM classification. However, recently, there has been a rise in oropharyngeal cancer due to human papillomavirus, and the existing TNM, which was derived empirically from smoking-related oropharyngeal cancer, is unsuitable for HPV-related disease. So there was a need to introduce a new staging system for patients with HPV-associated oropharyngeal cancer. The classification for patients without HPV remains the same, other than a change in neck staging that incorporates extranodal extension. This data shows the survival of patients with oropharyngeal cancer who have HPV. From this data, we can see that the old staging system worked well for HPV-negative patients, but in the HPV-positive patients, stage 1, 2, and 3 had similar outcomes. In nasopharyngeal cancer, the staging system was revised due to the impact of several alterations in management. These include improved imaging, which allowed more accurate determination of disease extent with reduction in risk of geographic miss by radiotherapy. The introduction of intensity-modulated radiation greatly improved tumor coverage for a subgroup of patients with adjacent soft tissue involvement. Therefore, patients with adjacent soft tissue involvement had improved outcomes. This was reclassified from previous T4 to now T2 category. Furthermore, the ongoing benefit of concurrent chemotherapy that was not part of the treatment when the earliest iteration of the modern nasopharyngeal TNM stage classification was first introduced has also influenced outcome. In this way, previously higher categories of disease can be reallocated to lower levels based on validated improved outcomes. For a list of helpful resources and publications on TNM staging, visit the UICC website, www.uicc.org/resources/TNM.